Mr. Griffith, for your 5 minutes of questions.
Thank you very much, Madam Chairman. I appreciate it. Let me dovetail a little bit with Representative Matsui. We had a discussion last week during the user fee hearing, February 3rd, last month, related to risk evaluation and mitigation strategies for clozapine and another drug that's name is hard for me to pronounce. And I just want to make sure, Madam Chair, that we are working on this issue. Dr. Joyce, Representative Matsui, Barragan, and I are all working on some legislation we hope to have coming out that will help on this. But as you'll recall, we learned that physicians, pharmacists, and patients lost access to the REMS platforms for these drugs when new platforms were launched late last year. And our legislation is intended to provide more accountability and transparency so the patient doesn't find themselves suddenly without medicine that they have relied on and need. So I'll leave that part at that point, but I did want to dovetail with Representative Matsui and her work on those areas.
So noted.
Thank you. Mr. Goff, I want to thank you for your written testimony and your support of the Inspections Act, which is H.R. 7006, which Mr. Welch and I introduced in an effort to improve FDA's inspections of foreign drug manufacturing establishments. This committee has heard many stories, some of them frankly horrific, about the conditions and the shortfalls of the conditions in foreign labs or foreign medicine-producing facilities, and our shortfalls of current inspection processes, and it's time that we start addressing them. You say in your written testimony that my bill could be strengthened, and that's always a good thing. You always want to learn what you can do better. With additional provisions on the use of alternatives to in-person inspections, and I'd first like to clarify, you say the FDA should be required to evaluate these tools when an in-person inspection is not possible, but then go on to describe a situation in which an in-person inspection does occur. In the first instance, are you describing a situation in which an in-person inspection may be temporarily impossible but later resolved?
Yes, that is correct.
Okay. And I suspected that was the case. The GAO report required by the bill that Mr. Welch and I put in would require a thorough description of all the alternative tools, including remote inspections other trusted countries are utilizing to facilitate inspections of foreign establishments. Could you briefly describe to the folks at home how a remote inspection works?
So a remote inspection, and it's not an inspection, it's an evaluation. So as the FDA has very eloquently said, it's a remote evaluation, RIE. And what they do is a virtual inspection, if you will, but it is not an inspection based on the legislation and how the legislation in 704 is written. Can't be an inspection, but it still does virtually the same thing. In fact, there was just an article in Pink Sheet this week that talked about, that the FDA talked about how they are doing these inspections. They want to make sure that the facilities have the right equipment so they can walk around with an iPad or a very high-level iPhone to be able to look at the different areas that they're inspecting. So they'll have the papers in front of them, the FDA will, at their desk. Then they want to do a walk around to see if the SOPs that they are reading and the actions are equal.
And that equipment is paid for by the manufacturing facility, is it not? The smartphone or the laptop?
Yes.
Yeah. And, you know, just got to say, obviously, somebody live and in person is going to be better. But when we don't have enough inspectors and when we are already way behind in inspecting some of these facilities, whether they be in Europe or particularly in Asia, this is better than nothing. I mean, we heard testimony in one of the inspections that they actually found feces on the walls in the areas where they were manufacturing medicines that then we're taking. And so at least this would show that, and even if they cleaned it up just for that day, that's better than not having anybody there. Isn't that true?
That is correct, yes. So it's not as good as in person because you may only see 3 of the 4 walls, for example, and the 4th is the one you're concerned about. But in today's world where we are not able to inspect, or the FDA says they're not able to inspect, we need to have another tool, and this is a very viable tool.
I appreciate it very much. Thank you. Dr. Esham, you were talking earlier, and you got into resistant microbials to our antibiotics. And I'm sure y'all are looking into it, and I would encourage everybody to take a look at The Perfect Predator. It's a book that I read about 1.5 years ago, and it's by Stephanie Strafty and Thomas Patterson. It's actually a love story with medical science all thrown into it. It's a great read, but it talks about phage therapy and what we ought to be doing and where we ought to be going, and I think that's a great tool for us in the future. Would you agree, yes or no?
Yes, and I'm excited to have a new book to read.
There you go. I yield back.
A good answer.